is a chronic disease characterized by hyperglycemia or high blood sugar. It affects more than 20 million Americans, and most of them are unaware that they have this condition. It increases risk for heart disease, stroke, kidney disease, and conditions called retinopathy and neuropathy, which we'll talk about. Indications of diabetes. A fasting blood glucose of greater than 126 milligrams per deciliter is a strong indication of diabetes. A 2-hour postprandial or post-meal blood glucose of greater than 200 milligrams per deciliter is also a red flag. These must be followed up with other blood tests. These show that the individual is experiencing hyperglycemia and indeed may be diabetic. This is because normal fasting blood glucose levels are under 100 milligrams per deciliter. 5% of all cases of diabetes is type 1 diabetes. It used to be referred to as juvenile onset because it was seen only in children, or it was diagnosed only in children, but it is now also being diagnosed in adults. It's more difficult to control because the individual, and we'll talk about this in a minute, is not producing any insulin. It is due to a genetic condition or viral factors that cause what's called an autoimmune response. In other words, the body is destroying the cells that produce insulin. In this case, the beta cells of the pancreas. And because there is no insulin being produced, the type 1 diabetic is often referred to as an insulin-dependent diabetic, and they must receive insulin exogenously or from outside the body because their bodies are not producing any. If we look at the physiology of type 1 diabetes, this little Y represents an antibody that is attacking the cells of the pancreas that produce insulin. So no insulin is produced. Blood sugars, blood glucose levels rise higher and higher because they are unable to move into the liver and the muscle cells. These blue and white eggs are muscle and liver cells, and this other symbol represents receptors on the cell membrane. Insulin is injected into the soft tissue and works its way into the bloodstream. So the treatment of type 1 diabetes is exogenous administration of insulin. The insulin receptors on the liver and muscle cells are then able to bind to the insulin that's being given and result in the cells of the muscles and the liver being able to take up glucose, and glucose levels in the blood begin to go down to normal levels. Managing the type 1 diabetic includes diet to match insulin doses and to keep blood sugars within normal range, and physical activity. 95% of diabetes is the type 2 variety. This used to be referred to as adult onset diabetes, but we're now seeing it being diagnosed in younger and younger children. It can be controlled with lifestyle changes and oral medications, oral hypoglycemic medications. It's caused by insulin resistance. Right? In type 2 diabetes, what you need to understand is that insulin is still being produced, but the cells can't use it. It is predisposed by obesity and genetics. So in type 2 diabetes, the pancreas is producing insulin, but it's either not producing enough insulin or the insulin is not being used correctly. Blood glucose levels remain high because glucose is unable to get into the cell. The insulin receptors on the liver and the muscle are insensitive to the insulin that's being produced. Drugs and pills taken orally work their way into the bloodstream, allowing the cells to respond to the insulin that the body is making. And blood glucose levels are then able to go back down. Type 2 diabetes is managed with diet. That's extremely important. And these are some of the recommendations for the type 2 diabetic. For many diabetics, losing 10% of their body weight can help bring their blood sugars under control. And regular physical activity. Again, for many people, exercise is like insulin. It makes their cells more sensitive to the insulin that the body is producing. Then we have what's called gestational diabetes, because this just happens in the pregnant lady. The risks depend on age, weight, and ethnicity. And what happens is they have an increased risk of delivering high birth weight babies. And these babies have an increased risk of developing diabetes later in life. Often the diabetes disappears after delivery, but the mothers are at a much higher risk of developing type 2 diabetes. This picture is supposed to show you why women who have diabetes during pregnancy have fatter babies, but let me just explain it a bit. These women have higher glucose levels in their blood, and so this glucose travels across the placenta to the fetus. So the fetus is getting a lot more to eat, and well, the fetus isn't exercising, so that extra glucose causes a bigger baby. Early warning signs and symptoms are what I call the polys. Polydipsia, increased thirst; polyphagia, increased hunger; and polyuria, increased urination. Long-term health consequences of uncontrolled diabetes include neuropathy, nerve damage, retinopathy, eye damage, nephropathy, kidney damage, as well as a greater risk of heart disease and stroke. The reason why the person is at greater risk of nerve damage is because with their inability to control blood sugars, the peripheral nerves, the ones at the tips of their fingers and their feet, are at risk of developing numbness. And what happens is what you see in this picture, a person who may have injured their foot. Diabetics don't heal as quickly. I'll talk about this more in class. They may not feel that they may have stepped on a tack while walking barefoot, and thus they develop infection. Retinopathy, a large number of type 2 diabetes and type 1 diabetics have issues with vision and blindness because the glucose deposits in the vessels of the eyes. And nephropathy refers to kidney disease. There are a lot of new technologies out there for treating diabetes. Type 1 diabetics require insulin injections on a regular basis. They must give themselves, as we said before, exogenous insulin, and they need to be very specific about how much they get. They have to determine what is appropriate. The insulin pump is a technology that has allowed diabetics to not have to think all the time about their blood sugars. It gives them warning if their blood sugars are dropping, and it also pumps insulin into their bodies at regular times throughout the day to match what a non-diabetic's pancreas might be doing. Now, many of you may have heard of the glycemic response or the glycemic index. I'm one who doesn't give a lot of credence to this for most individuals, but for the diabetic, this can be a very helpful tool for managing their blood sugar levels. According to the glycemic index, or the glycemic response, simple sugars and foods with what's called the high glycemic index burn up or are digested more quickly, absorb more quickly, and cause a faster insulin response, whereas complex carbohydrates take longer to be broken down and sustain energy better. So the glycemic index is a rating system that tells you how carbohydrates in foods affect your body. It is an indication of the rise in blood sugar in response to certain foods compared to plain, ordinary glucose. Glucose is assigned a value of 100. All other foods are compared to glucose. The glycemic index of a food can be a useful tool to those concerned about blood sugar control. And people with diabetes should eat foods that have a lower glycemic response or a slower entrance of glucose into their bloodstream. And these includes food high in protein, fat, and fiber. And if you turn your head to the left, you can look at the range of foods from low to high glycemic on the glycemic index scale. If glucose is down there at 100, peanuts up here at 13, my voice may sound a little funny because it's tilted to the right, no, to the left, because they have a very low glycemic index. In summary, the hormones insulin and glucagon help regulate blood sugar levels. Insulin decreases blood sugars while glucagon increases blood sugars. Hypoglycemia is another name for low blood sugar, and there are different types of hypoglycemia. Hyperglycemia is high blood sugar, and it may be an indication of diabetes. There's what's called type 1 and type 2 diabetes, as well as gestational diabetes. Unmanaged diabetes can have serious health implications. Individuals with diabetes should consider the glycemic index or the glycemic response of foods for helping to plan their diets. And selecting low glycemic index foods can be useful in helping to control blood sugars. Thank you.